It's Health View on your talk station, News Talk 640 WFNC.
And welcome back to Health View. This is Dr. Angela Ruff, and again, our guest this morning is Dr. Richard Forsyth of Capital Family Medicine. Their contact number is 919-878-8596. And again, if you just tuned in, we're talking about various sleep disorders and hopefully some solutions to help people overcome these disorders. Speaking of disorders, something we've heard a lot about is sleep apnea, and maybe you could tell us a little bit about that and how is it diagnosed and what are some solutions for this?
Well, sleep apnea, of course, Angela, is you cannot open a magazine or turn on any kind of health television network or whatever without seeing lots of plugs on sleep apnea. It's a very interesting phenomena. I think we're seeing a lot more of it nowadays, and I think that has to do with we're having a tremendous problem in this country with obesity. Mm-hmm. And it's interesting. We have a very finite area inside of our mouths and nasopharynx, and obviously with the weight that people are putting in around the face, etc. This is causing an increase in what we call obstructive sleep apnea. Mm-hmm. I should mention there are two types of sleep apnea, and I'll first of all tell you what apnea. Apnea just basically means stopping breathing. There are various definitions on which are pretty esoteric. I guess there are certain definitions of what is considered an apneic episode, but essentially you're having an inability to breathe for one reason or another. And the first reason is central apnea. And central apnea is a very, very uncommon as a soul factor. We see people, I see the sleep studies that come to me, and they'll mention that there's some central apnea mixed with obstructive apnea. But the majority of what we see, central apnea, is just you're just not getting the message to breathe from your brain. Most of the people who have that are people who have maybe some chronic lung disease, some severe chronic lung disease, or heart failure. But when it comes to the obstructive sleep apnea, basically what is happening, when you take a deep breath, you lower your diaphragm, and air, essentially, negative pressure is created in your chest, so you're basically just sucking air. Because of that negative pressure, this air is just basically sucked in through your nose, hopefully your nose. Some people have to mouth breathe because of their complete nasal obstruction. Mm-hmm. But when they attempt to breathe, some people, because of their excess weight, because they have allergies, because they have a septal deviation, somewhere along that passage from the nose down through what we call the nasal pharynx, which is in the back of the nose, and then the pharynx, which is the throat, somewhere in there, these tissues are collapsing. And the more they suck in, the more these tissues collapse. So they don't get any air or get maybe 25% of what they would expect to get.
Right.
Now, what happens, and the reason why this disorder is being associated with such consequences is you could be in a deep level of sleep, and the time you're probably most likely to get into major sleep apnea is when you're at your most relaxed. For instance, the tongue. We have the genioglossus muscle. When you're in REM sleep, which is your deepest level of sleep, that is when you are going to be your most relaxed.
Right.
And, of course, that tongue muscle is going to be most relaxed as well, and so that tongue can drop back and obstruct the airway. And in this level of sleep, this is a type of sleep that we find that is replenishing and refreshing. And what will happen is if you are obstructed, and once your oxygen level goes down, you are going to wake up. You might not wake up entirely, so you might not be aware of it, but you will move out of that REM sleep, and you'll move into a lower level of sleep. And this is being implicated in a lot of the chronic fatigue that a lot of our patients are suffering. They have all kinds of different studies that they do. How tired is this person?
Right.
They have
is it subjective,
questionnaires.
or are they more based on their feedback then?
Exactly.
Okay.
Yeah, unfortunately, a lot of these things have to be, there's certain objective studies, which are we've all heard of people going in and they go in and they get hooked up to an EEG machine and a machine that measures eye movements and measuring their breathing, etc. But as far as the subjective symptoms during the day, these are more scales that are applied, questions that they're asked. How easy is it for them to fall asleep during the day, etc.
So, I've heard of this breathing machine, or that some patients use. Have you seen success with that with some of your patients?
Yes, I have. The CPAP machine. There are patients. You give them a CPAP machine, and they will take that machine on vacation with them. They'll travel it, and they wouldn't go anywhere without it. Because for them, it really is life-changing. Unfortunately, the CPAP machine is kind of noisy. As you know, traveling's not easy, and all you need to do is have an extra little box that you have to take along with you. Your spouse might not be overly impressed with your appearance of having this mask stuck on your face.
It doesn't look sexy?
Well, most people don't think it does, but it's in the eyes of the beholder, I guess. But also, it's uncomfortable, or it can be uncomfortable. This mask must be quite tight fitting in order to work, and it's it's some people are kind of claustrophobic and don't like anything on their face. I'm sure you've experienced that in your dental practice. So, I think a lot of these, unfortunately, are not utilized. People feel, well, my problem's not that bad compared with wearing this thing. So I think the compliance, I don't think, is any better than 50%. But for the people who really have severe sleep apnea, I have a lot of patients who would not leave home without it. They wouldn't go on a trip without it, and they use it every night.
Now, I've heard that if a patient can lose weight, that really improves their problem with sleep apnea.
I really feel, Angela, that so much of our problem in this country, as we've discussed on other occasions, is definitely related to weight. We're seeing tremendous high incidence of sleep apnea in overweight people. It's much higher, probably exponentially higher. It does not, I want to mention, though, there are people who do have sleep apnea, bona fide sleep study proven sleep apnea, who are not overweight. As a matter of fact, I was reading an article the other day, and they claimed, and again, I wasn't in a position to do any further research on it, but they claimed that the incidence of sleep apnea was the same in Caucasians as Chinese people living in China. Now, I don't know if that's a valid study or not, but I think that's kind of interesting because as yet, the Chinese certainly do not have the obesity problems that we have in this country. But losing weight is very important. Perfect example, they've done studies on football players and linemen who tend to be the probably most overweight athletes of any popular sport, have a very high instance of obstructive apnea.
Yeah. Yeah, they didn't call that football player the mini fridge.
No, they didn't call him the. They didn't call him the Frigidaire or whatever. I mean, he was. That it's certainly a position that a little weight helps you.
I mean, they're just so. You see, their neck is just about the same width as their head. I mean, it's so muscular too. You just kind of wonder if that isn't putting pressure on the airway.
No question. It's weight. If you've got large muscles. I mean, these guys. Let's face it. There's real strong guys. They've got a lot of encroachment. You only have one. There's only so much area available, and with that extra weight from the muscles or whatever pushing back on that jaw when they're in a total state of relaxation.
Right.
It's a significant factor.
Right. Kind of in line with this is snoring. What are your thoughts on that, and some solutions for the patient or the patient's spouse?
Well, snoring again. It's interesting. We look at snoring in two ways. There's snoring that is associated with other diseases, and then there are people who are just primary snorers. One of the things they talk about, people with sleep apnea, whether it's a comorbid factor, they have a tendency to have a higher incidence of heart attack and stroke. Now, people who are just snore and don't have obstruction, they don't have that problem, but they many times have unhappy spouses. One of the things that I sometimes suggest, half facetiously, is, have you talked about getting your spouse a nice set of earplugs? but seriously, when it comes to snoring, the reason why people snore is because they do have some turbulent airflow coming in through their nose, coming down the back of their throat, and turbulent airflow will cause vibration, and that's what snoring is. It's the vibration of tissues in the upper airway.
Right. Now I'll tell you, there's been advertised lots of mouth appliances that your dentist can make to help you not snore. I think we have bought every last one of those and tried them on our patients and refunded all of our patients their money for that.
Well, I know it's too bad. I think the theory is very good, but I guess there are a lot of factors that make people uncomfortable. What I've heard, it can make people's TMJ worse by pulling their jaw forward.
Yeah, because you have to thrust their jaw forward to prevent them from snoring. Now, I'll tell you, there's a ENT in town that I refer my patients to who want to stop snoring, and they can do a little minor in-office procedure for about $500, and that seems to work quite well. They'll remove some of that loose tissue behind the pharynx. I think they do it with like a little laser.
Exactly, and I think it from what I've read, these things are quite effective. I think sometimes when people spend a lot of these times, sometimes insurance covers it, sometimes doesn't. So when people are paying that money, the doctor might look at it as a great success. He's cut their snoring down 70%. But I think where some of the confusion comes in, I think these things obviously open up the airway a little bit. They cut down this vibration, and yet sometimes the patients aren't happy because they're still snoring a bit. But it's a matter of defining what is success.
Yeah, well, if it goes down a bunch of decibels, but they can't define it. Their spouse still left them. Maybe it wasn't the snoring. Anyways, but that was some great information, Dr. Forsyth. So if I guess people would go contact their physician if they wanted to get a sleep study or if they felt like they may need that.
Exactly. I think that, discussing, and I think one of the things that really, there are all kinds of causes for the fatigue that a lot of us are suffering right now, but it's something that has to be in the differential diagnosis. I think we have to watch it because many of these websites and these advertisements are trying to blame everything on obstructive apnea.
Right.
Whereas I think, as we've discussed many times, Angela, I think our overall lifestyle, most of us could use an upgrade.
Sure. So you've been listening to Dr. Richard Forsyth of Capital Family Medicine. Their contact information is 919-878-8596. This is Dr. Angela Ruff with HealthView. Well, and thank you for listening in.